Hey guys, Dr. Bodle here, and thanks for joining me as we do a bit of a focus video today on how hypothyroidism can contribute to joint pain and the strategies you should be using to help improve in these areas. I gotta say, I'm always nervous calling a video focused here at the beginning because, that's the one that turns out to be 30 minutes long. But we will do our very best to stay on target, and of course, if you've been enjoying the content, please remember to like, subscribe, ring the bell. I post videos on natural strategies that you can use to help out with your Hashimoto's and hypothyroid symptoms. And by doing those things, you support the channel and you won't miss any of the new videos that I post every Thursday morning. But to get started, how is hypothyroidism connected to joint pain? It's not something that you commonly see on your standard list of thyroid symptoms, but it is something that is associated with almost every patient that comes through my door and is struggling with some of those more classic thyroid symptoms. Can you have joint and muscle pain due to old injuries or surgeries? Of course you can. But there are some unique changes that hypothyroidism causes in the body that can lead to those old injuries either being more severe in the pain that you experience or more frequent, and they can also cause pain in other parts of the body that haven't been previously injured. The first big reason why this happens is because decreased levels of thyroid hormone or decreased utilization of thyroid hormone decreases our metabolism. As we've said many times before, thyroid hormone drives our metabolism. It's what allows our bodies to function and go and do their specific jobs. And if we have an injury or tissue is torn in some way, then we need a healthy metabolism to be able to start to repair and recover that area. The other problem that we can have, in addition to our body not properly utilizing thyroid hormone and therefore not setting our metabolism, is that hormones often follow a bit of a Goldilocks principle. We don't want them too hot, we don't want them too cold. And for hormones, we don't want them too high or we don't want them too low. In both scenarios, the abnormal level of hormones can actually cause an inflammatory response. But unlike a direct and local injury, say something like a sprained ankle, where the inflammation is specific to the area that's injured, when we have thyroid hormone changes, since every cell in the body utilizes thyroid hormone, that inflammation tends to become systemic. So think about that for a second. When you do sprain your ankle, what happens? It becomes swollen, hot, red, very sensitive, and it can be very painful to walk on it. These are all signs of the inflammatory process, and they signal to your body that something is wrong and help is required. But it's also a protective mechanism to prevent you from overdoing it with that ankle and potentially making things worse. So if we know what an inflamed ankle feels like, what happens if that inflammation is systemic? Well, instead of a single joint being impacted, now all of your soft tissues, your muscles, joints, and ligaments are bathed in an inflammatory soup, making them sensitive, easily irritated, and yes, painful to even trivial and normal types of movement. Because the whole system is involved in these scenarios, one of the dead giveaways that someone is suffering from joint pain due to inflammation is the presentation is bilateral in nature, or it affects both sides of our body. For example, someone who's dealing with old injuries and the reason they're having pain is purely due to structural changes, they will come into me and say, yeah, my right ankle really bothers me and I also have issues with my left shoulder. Two focused, specific areas that don't have much to do with one or the other. And they have a history that's related to some sort of incident, accident, or overuse. But someone who's having joint pain due to inflammation will say something like this. Yeah, I experience a lot of pain and it's fairly constant for me. It does get worse when I'm more active, but I notice it in both my ankles, both my knees, both my hips, probably in my back, my shoulders, my arms, my wrists. And these days, due to the right hip injury that I had 10 years ago, that whole right hip and upper leg area can get really bad for me. See the difference between the two? One is specific, defined, and clearly tied to a mechanism of injury. The other is generalized, diffuse, and affecting most parts of our body, while highlighting those areas of previous injury. And to take things a step further, many times when people who are experiencing chronic pain from inflammation get some sort of physical modality or treatment, they feel better for a period of time, but that treatment never lasts. The reason for this is because the treatment does help with the local inflammation, but it doesn't address the underlying cause. And until we can support our thyroid and reduce overall inflammation in the body, we're not going to have long-term success. So what can we do from a natural perspective to help out with our joint pain? Now, of course, I would like to say that if you're someone who needs medication, it's something you definitely should talk with your doctor about. As we already discussed in this video, hormones too high or too low can be a problem for us, and it's important that we have the right amount available to our cells when needed. So finding the right kind of medication that supports your body, treats you the best, and helps to manage your TSH, T4, and T3 levels is certainly something that we want to make sure is on our checklist. But number one for helping with joint pain, even though it might sound a little bit obvious, but it's something that I see people missing all the time, is make sure that you're staying hydrated. Now, recommendations for hydration seem to be all over the place. And maybe you guys have heard something that I haven't, and if you have, I would love to know about it, but there doesn't seem to be a lot of consensus on this. The classic recommendation is 8 8-ounce glasses of water every day for a total of 64, but I honestly think the reason why that's usually recommended, and you see it in different articles, is that it's easy for people to remember, and it might be a decent baseline. On the other hand, taking half your body weight and drinking an ounce of water for every pound is also very popular. And then you'll see some recommendations on the higher end, which often look like drinking a gallon of water per day, which of course may be more or less than half your body weight, depends on the person. But no matter what the recommendation is, I find that most people are simply not getting enough. And the reason why a lot of those recommendations probably work is because they take you from a low intake to a more moderate or reasonable intake. But instead of giving a fixed amount, I like my patients to look at function. I want them to drink water before they get thirsty and not waiting until they feel like they need it. I want them to track their hydration and salivation in their mouth and confirm that their saliva isn't getting too sticky and their mouth doesn't feel too dry. And finally, looking at the color of your urine can be another key indicator. A lighter straw color to your urine is a good target to shoot for. Additionally, you guys probably know that I'm very big on hydration, not just being about water, but also the electrolytes that we're taking in. I think this is something that's important for everyone, but especially for people with hypothyroidism who can have disturbances in this area. The more stressed we are and the more chronically fatigued we are, the more likely that we can benefit from some electrolyte support. And if that's something that you think you might need some help with, I'll link for you in the cards above my video on the topic. Step number 2 for reducing joint pain is using flavonoid nutraceuticals that have been shown to be anti-inflammatory. Of course, some people will need more of an anti-inflammatory punch here, and medication can be a reasonable strategy. But in my opinion, we only want to be using these anti-inflammatory medications if we have to. And long-term usage can certainly come with side effects, and we can see a decrease in effectiveness, which of course can cause these approaches to lose some of their luster if the risk is high and the benefit really isn't that great. Instead, even though they might be a little less potent, using natural compounds can have less risk of side effects, and they can be used over a long period of time. I always like to make sure that the particular supplement we choose in the beginning fits well with the patient, and as long as their system is tolerating it, we can build it up to a more therapeutic level. There's a lot of good options out there in the anti-inflammatory category, and again, I think our best choice comes down to the fit. Because I don't want my patients taking a million different things, I try to choose supplement options that address multiple areas for them at one time. For example, curcumin can be anti-inflammatory, and it can also have a blood sugar lowering effect. So someone who's inflamed due to their thyroid changes, but is also struggling with high glucose levels, might benefit from a curcumin supplement in a multitude of ways. Another way we might think about it could be using an omega-3 fatty acid. These are also anti-inflammatory, but they can also support proper and healthy hormonal function. So if someone is inflamed, but they're also having issues with PMS and heavy menstrual bleeding, then omega-3s might be a better fit for them. This is where an individualized approach really comes into play, and we can have fun as long as we understand the underlying mechanism. In addition to the ones I already mentioned, curcumin and omega-3 fatty acids, I also like using in my practice resveratrol, glutathione, and CoQ10. But if you have some of your own favorites, let me know in the comments down below. Again, there isn't necessarily one right answer here, but if you'd like to compare some of the things that you like to use to the products that I use in my practice, you can always check out my full script account that's listed in the description box. And once you access my page, you can see all of the different options that I provide to my patients and my online community. And finally, our last strategy for managing joint and muscle pain is the one that's hard for the vast majority of you, and that's regular movement and exercise. Now, even though it's way easier to take a supplement or medication than it is to move on a regular basis, exercise provides us with unique benefits. And these benefits cannot be produced or replicated by anything that we take in a pill form. Lack of movement can lead to adhesions and restrictions between the soft tissues. And it can also impair our neurological system's ability to regulate pain in our joints. The unfortunate thing is, many people get stuck in a vicious cycle where they start to develop joint pain, so they move less, which then makes their joint pain worse, which then leads to them moving less. And not enough doctors or practitioners are willing to tell them that they have to move to get back on the path to recovery. Sure, flavonoids can support antioxidant activity, but you know where most of your antioxidants come from? It's from exercise. But not only does exercise help to reduce inflammation, but it also stimulates the release of unique growth factors that are needed to help heal and recovery, especially from old injuries. But how should you exercise when your body's in pain? And the answer is, you want to do the highest intensity exercise that your body allows and allows you to recover to 100% the following day. Now, when I say recover, I mean it in regards to your overall function, not necessarily the soreness that you would get with a new activity. So if you exercise and either after the exercise or the next day you have a headache, you're feeling dramatically fatigued, you need to sleep for extended hours, you're noticing more brain fog, and your system is just off in general, then you've likely overdone it. If you're sore, that can be okay as long as the sore parts of your body are the ones that are related to the exercise that you performed, and you're not getting an increase in that generalized soreness that we identified earlier. But do keep in mind, for some of you who have been in pain for many, many years, it can take months before we're able to exercise without soreness and pain. Those tissues need time to restructure, and it's not something that's going to happen overnight. So pay attention to function first, be mindful of the soreness, but be aware that it might be present, and if you do start to feel worse, it's okay to take a break. Recovery is just as important as movement, and if we need to, we can change the frequency of your exercise, the duration of your exercise, or reduce the intensity. When I say that you need to move, it doesn't mean going to the gym for 2 hours or running 30 miles on some mountain trail. And if we get that idea in our head where we need to suffer or really earn our workouts for them to be worth our while, most people are going to be severely overwhelmed and many will never start. So if you have to, start small. And as I said, start with the intensity that your body allows. For some of you, that might be stretching. For others, it could be yoga. Maybe walking around the block is an easy way to keep things in check. Or spending some time on your stationary bike. And if you have a background in exercise and are able to do things like weight training and that makes your body feel good, then do that. Whatever it is, pick something you enjoy, pick something that you can be consistent with, and track it. Once you combine a little bit of effort with some tracking, you'll be able to dial up and down the intensity based on how you respond, and also progress your workouts in a sensible and tolerated way. But what do you guys think? Let me know what's helped you to manage your joint pain, and is exercise something that's part of your care plan? We're all a little different, and it's always great to see the things that other people are having success with. Also, if you like today's content but feel like you need some additional help, then I really encourage you to take the next step and email me at contact@seattlethyroidhelp.com. From there, we can see if you qualify for a free consultation with me And during that consultation, we can discuss your health goals, what sort of support you need, and if we're a good fit to work one-on-one together. I help people with thyroid and autoimmune symptoms on a regular basis. It's something I'm very comfortable with, and I think that we can provide you with a unique perspective to help you get well. So if that's something that you're interested in because you haven't been seeing the progress you deserve and you need a clear plan for what to do next, then I think the consultation would be of great value to you. If you'd rather work on some things at home, then make sure to check out my free downloads down in the description box or any of my other videos on the channel. As I mentioned before, there's also a link to my FullScript account where you can have access to any of the supplements that I use with my patients, especially if it's something that you think is lacking in your care plan and you want access to the highest quality supplements. That way you can achieve the best possible outcomes. Of course, let me know if you have any questions there. But that's all we got for now. Thank you so much for hanging out with me. I love you guys. I hope that you're doing well. If you enjoyed the information, remember to like, subscribe, share the video with someone who could use it. And if you're looking for daily information, don't forget to follow me on Instagram or Facebook. My name is Dr. Bodle. I hope that you guys have a great rest of your week, and I'll see you in the next one.